Awesome.
And for your specific situation, we would consider whether or not we involve our breast surgeon.
Okay.
Because with a typical transgender mastectomy, we take off most of the breast tissue, but we leave a little bit behind.
Right.
And so we just have to decide for you if we wanna get every bit of that breast tissue out, or if we're gonna do a more standard approach, so
Okay.
that's what we.
Now, when would would I be setting that appointment up after the consultation, or and then setting up the surgery date, or am I setting up, like, how are we doing now? Like, just so I'm not confused.
Well, I would recommend that we proceed with everything all at the same time.
Okay.
Cause we're booking out several months now, just
Okay.
for our elective cases.
Awesome.
So we've got time.
Awesome.
We'll also put in a referral to our high-risk clinic and have you meet with one of our geneticists.
Okay.
But, so we'll pursue all those things at the same time, but
Okay,
let me tell you a
awesome.
little bit more about the surgery.
Yes,
I know you've had
please.
another consult, so you probably know a little bit about it, but.
Oh, that was like last year, and a lot of things have happened since then, so I probably forgot most of it actually.
Okay, well then we'll go through it again.
Awesome.
So this surgery is typically done as an outpatient, meaning you come in, have your surgery, get to go home the same day.
Okay.
So you definitely need somebody at home with you.
Yeah.
Who is at home with you?
That actually, because my parents live on a farm and they have so many animals, and I'm like my dad. If there's work to be done, I have to do it, and if I don't do it, then I'm like, eh. So I'm gonna be either staying with my cousin at her place, or I have a couple of other places that I can go. That there's gonna be somebody with me all the time that has less animals, and hopefully I'll be less tempted to get up and do stuff I shouldn't do.
Where's the farm?
Up in Sheridan, between Dallas and Willamina, like on Highway 22, like when you go towards Lincoln City. Yeah.
I'll help.
While
you're out of commission.
I'm like, hey, I found somebody who can help.
Okay, so yeah, you do need somebody at home with you at least the first night to help you after having a general anesthetic, because this is full general anesthesia. You would have drains, so those take a little bit of work to deal with.
That would have to be like somebody helping me with that, because I'm totally like excited about getting the procedure done, but I know me, I can't even sit through a movie where they show a woman giving birth without going like, oh, I'm good. So it would have to be somebody who, like my cousin, who would have the stomach to clean it without passing out on me. Like
they are remarkably easy to handle. I don't have a single patient who hasn't found them fine to deal with, so I know you would too, but it's nice to have some help.
Absolutely.
We also, for your case, where we do a free nipple graft, because that would be the best way to get your nipples into the right position and make them look most appropriate for a male chest. So with the free nipple graft, we do put these big puffy dressings over the grafts, and they're sewn on, and it's really important that stay clean and dry and not have any shearing force, no motion over it. So we put those on, sew them on, wrap you up, and have you just stay with that dressing for the first 5 to 7 days.
Okay, then what about, so then how do we, about
you sponge bathe?
Yes, so it's easiest just not to shower for the first week. You can fill a tub with a couple inches of water, sit, sponge bathe that way. But it will serve you well just to keep that dry.
Well, I probably won't be doing anything those 7 days outside of sleeping anyway, so it's all good.
Perfect.
I'm like, knowing me, I'll be like, I just want to sleep, just leave me alone, let me sleep.
So a couple things about the surgery. There are scars that run all along the crease where the breast crease is now. We had a little bit of a discussion earlier about some scar management. That's something we really focus on after surgery and make sure that you get going with some scar treatments. And as I mentioned, I do recommend silicone gel sheets. They're really effective at getting scars too.
And I would get those here?
We keep them here, so we'll address that right after your surgery. With any surgery, there's risks.
Of course.
Risk of bleeding, risk of infection. We're always looking to create perfect symmetry. Sometimes it takes a revision to get you to that point where we're together. You and I are really thrilled with the symmetry that you have. Sometimes there's little bits of extra tissue at the corners of the incisions, dog ears. Those are
I'm used to dealing with the dog ears now anyway, so like at least it'll be less as bad.
Yeah.
Because wearing a binder makes it worse.
Yeah, well, that is the thing that most of our patients are most thrilled about is getting rid of their binder. So
Yes.
that would be nice for you.
Definitely. Between how much it costs to have to replace those things and just, like I said, working on a farm, like, it sucks when it's during the summer and you're out there with all the other guys doing the farm work and you're like, I'm gonna freaking die because I'm so freaking hot because I have to wear this many layers and with socks. Like, so that'll be nice.
We'll get you out of that.
That'll be very nice to be out of binders. I also perform, I actually do performances at the Speakeasy for shows. So
What type of performance?
I kind of do like what the drag queens do, but I don't do it in drag. I'm considered a male performer. I kind of gotten a little more risque lately by getting down in my underwear and a shirt. But it'll be nice to not have to wear a shirt with the underwear. Like, that might actually like help me a little bit more. Like,
We have video.
yeah.
That I want to see.
Yes, we do have video.
That I want to see. All
We
right.
do. It's on my phone.
So, burlesque.
Kind of, yeah. Or think more like Magic Mike without the really hot Channing Tatum thing. Because I'm not no Channing Tatum. I wish, but I'm not.
Okay, I definitely want to see those videos, but all right. Well, we'll get you there. You know, it takes a
Awesome.
while for the scars to get to the point that if you were concerned about having visible scars, it takes about a year for scars to get as good and
Yeah.
mature and as.
I don't know if I'm really like, I don't know like if that's really gonna like phase me for the plain simple fact that for me it'd be like, this was a part of me being able to live my life the way I should have been able to live it the first place. So it would be more of like, yeah, if they're there, they're there. I'm gonna be proud of them because they're part of me and my journey and what I went through to get to here. And I'm proud of how far I've gotten so far. So I look forward to the next step. Really is where I'm at.
That's a great attitude. All right.
So
I want to tell you just a couple things about the nipple grafts because they're also a little challenging at first.
okay.
We haven't had any problems with nipple graft loss. We haven't lost any nipple grafts, but that is always a risk when you do that because we actually remove the nipples and the areola around them, cut it down to the right size, put it back on as a graft. We have to create a little raw surface for that nipple graft to stick onto.
Okay.
And
So it's kind of like, because we did watch a video on YouTube. I did actually watch a video on YouTube about the double incision, and they did show like how they do the nipple graft things. I don't know if it's the same. I think maybe every doctor might do it differently. They might have their own technique. But it was really actually kind of cool to watch it and go like, oh, so that's what okay. Like, that's what I'm going to go through. I'm all right with that.
Good. I'm glad it didn't.
The
didn't
last
turn me away.
doctor I talked to when he was talking about the nipple grafts, he said that the only issue he ever had was he had a patient that he told the patient, warned the patient that if they smoked during their healing process of the surgery that it distorted the nipple grafts and everything and made it like come out not the way that the doctor originally had it done.
Well,
So
nicotine in any form, whether
Right.
you smoke it or use a patch or gum, can affect your healing. We think it does that by constricting some of the small blood vessels,
Okay.
which limits the blood supply. And what we want is lots of healing blood,
Absolutely.
bringing oxygen to these areas of healing. So, yeah, no smoking is a critical factor in
I'm glad.
healing up.
I'm glad we're getting this on video because, like I said, I've seen many top surgery videos where people have gone and done that, and they don't cover, okay, well, what happens if you're somebody who needs to be on a nicotine patch or anything because of, like, smoking, blah, 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 during the healing process. Like, I don't see anybody cover that, so I'm glad we're covering that because I think that's important for people to know. Because I didn't know that. I did not know that until I saw the last doctor I saw, and I went, oh, well, there's many reasons to quit smoking, and I just found another one.
Yeah, also smoking really ages your skin, you know, so.
That's why like people like my doctors are going like, because I started smoking at a young age, mainly because my aunt embarrassed me in public and it was really bad. But like that's a sad reason to start smoking, but it was really that horrible. And I had been smoking ever since I was 16 off and on. Like I quit for a year once and then just a whole bunch of stuff happened and I'm more of a stress anxiety smoker than I was anything else. So when things started getting stressful in my life, I started smoking again, which is another reason why I try to keep my stress down because I don't want to continue having this back and forth battle with that. So I've had a great doctor who's been helping me with that. Dr. Cho has been a freaking angel on this whole journey. Like she's never had a transgender patient until me, and she's just been very helpful with the process. And I have a great primary care physician who can also help me through, any other healing part process that you guys may not be able to do for me. She'd be able to help me work through too. So I have that support, a very good support system between friends, family, and my doctor. I'm set. I'm good.
You are set. That's so crucial to have that. And the great news about smoking is by you quitting now, which sounds like you have, and I'm so thrilled that you were able to do that. You can really revert back to a normal risk for things like lung cancer.
Exactly.
The longer you stay off cigarettes. So there's never a time when it's not worth it to quit. So that's the best gift you can give yourself.
Which is it's also I've seen commercials about where they actually compared the people who actually go and they think, oh, well, if I smoke from a hookah, then it's less danger to my health. And every commercial I've been seeing lately is no, if you sit down for 30 minutes to 60 minutes and smoke a hookah straight, that's up to over 2 packs of cigarettes. I'm but you think that's healthier than smoking a cigarette, than just going out and having a cigarette, but you're gonna sit there for 65 minutes and smoke out of a hookah and think that, oh no, I'll be fine, that's not gonna kill me. I'm well, didn't know that, don't smoke out of hookahs, so it's okay.
Okay, do you have any other specific questions?
When it comes down to during the first 7 days of the healing process, food-wise, am I gonna have to go on some kind of liquid diet or something, or soft food or anything?
You can eat anything you want, right?
Okay.
From the time you wake up from surgery, and as soon as you're feeling good, you can get back to normal diet.
Okay.
And we encourage you just to eat a good, well-rounded, healthy diet.
Okay.
Both coming into surgery and coming out of surgery.
That would be the other question. Is I don't, because it's this a top surgery, I'm not gonna have to go through some weird laxative clean out the whole body thing, am I? Okay, good.
No special regimen.
Thank God.
Surgery for that.
Because my mom's you might have to. I'm I don't want to do that part. I'll do it if I have to, but I don't want to.
That would be more for bottom surgery, depending on what operation one has. But for top surgery, no.
No, me, I'm definitely one of the mini trans guys who's yeah, I'm cool off of the bottom surgery. Especially after we actually watched a video about it on YouTube. I'm now, if I wasn't cool about not getting it before, I definitely am not doing it now. Well, that was just graphic and horribly wrong.
Well, we do have a new surgeon starting this summer. He's just a fantastic guy. His name's Dr. Burley, and it would be maybe worthwhile for you just to come and have
just gotta talk to him about it.
Have a meeting with him, see what your options are, and.
Because I think for me, a lot of it is I'm one of those guys I enjoy sex. That I've been told with that procedure, there's also that possibility that you won't have the same sensitivity, and you can't get the pleasure out of it, and. I'm not okay with that. I'm one of those guys just no, I have to at least enjoy it, or else there's just no point.
Most people would agree with you, so.
That and there's, or I'm a firm believer that just because I don't have a biological penis doesn't change the man that I am. I've pretty much that's been my thought process all my life. Is it's not what's between your legs that makes you a man. It's what's in here and what's up here and how you act. Because you don't have to have a penis to be a man in my book. You just be a good person and act like a man and do your thing and just don't be an ass, basically.
All the women of the world thank you for that last statement. So.
Yeah, I'm trying to teach my dad, but he's too old to get it.
All right, Christopher, I'm going to leave you with Dr. Madsen to finish up.
Awesome.
It sounds like you are kind of committed and ready to go.
Yes.
So we'll do a couple other things today. We'll get some photos.
Awesome.
If that's all right.
I was actually going to ask you, do you have any post-op pictures that I could look at?
Absolutely. We'll bring some.
Awesome.
We'll bring some pre-op and post-op photos in and show you some of my patients.
That would be great because the last consultation doctor I went to, he didn't have those, and that was kind of an issue for me because I'm I want to be able to trust you, but I can't really trust you without seeing your other, what other patients, turnout has been, if that makes sense.
Absolutely. We'll bring some photos in for you. We are coming up on about 90 patients that we've done here just for top surgery.
Oh,
so
wow.
It's been a really good, busy time.
Oh, wow. That's awesome.
Yeah, we're happy to show some results to you.